Within Northern Ireland, the Health and Social Care Board Business Services Organisation, in partnership with Orion, have worked to develop and implement an optometry view NIECR. The Northern Ireland Electronic Care Record, and in particular the optometry view of that, is a single point reference source, a repository if you like, of information, both medical and ophthalmic, which an optometrist in primary care can use to access information about their patient, either for the purposes of planning for an appointment or during a consultation. In Northern Ireland, there were several strategic, policy and other drivers to roll out access to the ECR for primary care optometry. The Department of Health policy document, Health and Wellbeing 2026 Delivering Together, has many commitments, one of which was to facilitate better integration between primary and secondary care. And the optometry NIECR workstream fell very well within that piece of work. In addition, the Health and Social Care Board's e-health strategy and plan made provision for the NIECR and the rollout to primary care optometry contractors. Developing eye care partnerships was another strategic policy document, a 5-year plan to improve the provision and commissioning of eye care services. And last but not least of all, ophthalmology as a very high demand specialty within health and social care created, I suppose, if you like, a momentum whereby primary care optometrists as key stakeholders within that specialty and feeding into that specialty benefited greatly from access to ECR. An optometrist logs into NIECR using generally the patient's unique identifier, their health and care number, and following receipt of consent, which is an important part of NIECR, the optometrist will be able to view relevant medical and ophthalmic information. This would include current medications, any known allergies that the patient may have, any referrals which have been created to ophthalmology and eye care services within secondary care. It also contains information on the clinics that a patient may have attended within secondary care, either as perhaps a one-off or on an ongoing basis for chronic conditions. So it's a single point source which they can go to access either during a consultation or in preparation for a consultation in association with their patient, and it enables them to obviously be afforded continuity of care for some patients who are already within the secondary care system, but also for those who are maybe requiring referral, and that information within the ECR will help the optometrist in their clinical decision making in discussion with the patient. To date, the feedback has been very, very positive. We have implemented ECR in late 2018, about 9 months at this stage, and to date about 268 optometrists, which is over 50% of the workforce in primary care, have availed of an NIECR account. Last month there have been 1,000 logins, individual logins to ECR, which is testament to the benefit that it is bringing to primary care. Feedback has been very positive. The optometrists have advised me that they have sourced information which previously they would have found very challenging to get, information on patients who have attended eye clinics, perhaps on the treatments that they have had, the plans for their future care, etc. So it's been a very, very welcome addition to the armoury within primary care optometry, and will further support better integration and quality improvement initiatives within ophthalmic services.